America's healthcare advocate, Carrie Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HI Radio Network. You can find out more about us by going to the website, americashealthcareadvocate.com, americashealthcareadvocate.com. Also, all these shows are posted on 15 podcast platforms now. That's right, 15 of them. We just added iHeartRadio, so you can find us on just about any podcast platform out there, and, of course, on YouTube. By the way, we're up to about 16,000 views, 16,000 downloads, I would correct that, on the podcast platforms, and we've had 257,000 people go to the YouTube platform. So a lot of people paying a lot of attention to what we're doing here. We're very happy to be able to do that. The man that makes all that happen is Mr. Dave Thiessen. He's the man behind the camera that does all of this, puts it all together, and gets it up on YouTube and on the podcast platform. And our producer, the always perfect Mr. Darren Wilhite from Odyssey here at our Odyssey studios in Kansas City. All right. If you are chronologically challenged and you're looking for Medicare, every week you hear me say you can get a hold of the lovely Carolee Steele at RPS Benefits by Design. And guess what? She's in studio today.
Hello,
Hi, Carolee.
How
Welcome
are you?
back.
Thank you.
Glad to have you here today. So we're going to talk about all things Medicare, and also joining us in the studio today, and I also call her out every week. If you're an employer out there or a broker and you're looking for some really good employer benefit options, Maria Ahlers. Welcome, Maria.
Hi, Carrie. Nice to see you again.
Well, it's great to be back in here again, have you guys back. So let's just kind of start off with, we're out of the open enrollment season now. We're past all of that. Let's talk about, for folks that are aging in, let's just start off with Medicare. Okay. And for folks that are aging into Medicare, they're turning 65. Where was I at we were in Nebraska. This is a week ago. And the CEO of Blue Cross and Blue Shield of Nebraska called Ron Rowe, who we're working with up there, and said, hey, I'm really confused about Medicare. Can you send somebody over to help me? And they sent over Adam Welch from Blue Cross and Blue Shield. He spent some time with them, and he called back to Ron afterwards, said, God, I really appreciate that. The point about that story is this gentleman is the former CEO of Blue Cross and Blue Shield of Nebraska, and he didn't understand it. So it's confusing as hell for people, is it not?
There are so many moving parts. There's typical questions of people aging in. Do I have to go to Medicare? What do I do? What do I do now? And the questions typically are like, first of all, do I have to sign up for Medicare? How much is Medicare? What if I have an employer plan? Because about a third of all people who are at the age 65 keep working. And so, can I leave my employer coverage? Do I have to leave my employer coverage? I got my blood drawn last week, and the lady said, well, my husband's turning 65. Doesn't he have to, or I have penalties? I'll have a lot of penalties. And I said, well, every situation is different. There's no one size fits all with Medicare. It completely depends on, are you the spouse? Are you the actual Medicare eligible person? Do you have employer coverage? And so all of that taken into account, that's what we do. We help them walk through piece by piece according to their particular situation and help them the best way going forward.
Yeah, because it's the alphabet soup of Medicare. So we talk about Part A, Part B, Part C, Part D, Part F, and Part H. How do people figure all of that out? What applies to me? What doesn't apply to me? It's confusing.
It's very confusing. And I've even had someone yesterday call in and say, as far as Part D, do I have to get Part D? I don't take any drugs. I'm like, but there are penalties involved in that. So there's a lot of little moving parts that people need to be aware of. So
when I used to get that question, then they would say, I don't take any drugs. I would say, now.
Yeah.
Add the word now to the end of that conversation, because if you're a seasoned citizen, 65 or above, at some point, okay, unless it's a miracle, you're probably going to take some medication between now and the time that you leave here and go to the next earth plane, or whatever you want to call it. Okay, but those are the questions people ask because they're confused by this stuff. So let's just go back to this. Where do they start? So they haven't signed up for Medicare. They don't know. They're not going to be on an employer plan now. We'll go back to that in a minute.
Okay.
But let's just say I'm not on an employer plan. I'm retiring now. I'm coming off it. Where do I start?
So most people think you call Medicare to get Medicare, but that is not true.
Please don't call Medicare.
Do not call Medicare.
We've got stories you don't even want to hear about people that have called Medicare and people that have called the government healthcare website for ACA. We'll talk about some of that later on, but yeah, don't call them, okay?
So you actually go through Social Security to get Medicare, and that's how you would do it. So there is Medicare Part A, that's hospitalization, Medicare Part B, that is pretty much medical and everything else. Some people say, well, Medicare only covers about 80%. Then what happens? That's where we come in. So we kind of introduce all the possibilities that can cover that 20% that Medicare does not.
So let's go back to that because it's the Part B we're talking about here that they've got to sign up for. If they don't get Part B, they can't get a Medicare Advantage plan. They can't get a Medicare Supplement plan. And when you talk about 80%, you've got Part A and Part B. You go into hospital and have a $100,000 hospital stay, you're up to plate for $20,000. That's why you sign up for a Medicare Advantage or Medicare Supplement program. That's what a lot of people don't. Well, I've got Medicare.
Right.
You're right. That's what you've got. Okay. What you don't have, there's no cap on that 20%, Carolee.
There's no out of pocket. And so a lot of people will call and they would have A, B, and then their drug plan. Like, I have a drug plan, I have A and B, that's the only thing I need without penalties. But you're leaving yourself exposed to 20% of all of those services, and like you said, there's no out-of-pocket with the government. So you're on the hook for all of that.
Yeah, and here's the thing, okay? The Medicare Advantage plans, every carrier out there that has a Medicare Advantage plan, Blue Cross, Aetna, Humana, United, they all have zero premium plans. So talk a little bit about, you don't have to do a plan where you're going to pay a large premium.
Correct. So most of the Advantage plans have a zero premium, and there are copays and co-insurance along the way. Most people have a primary care physician visit that would be zero. Specialists maybe 30, 25, 30, depending on that. Copays, co-insurance, and there always is an out-of-pocket maximum, and that's how much they would be exposed to should they reach their co-insurance, to, like, let's just say $3,500. At $3,500, the rest of it, any A and B covered service is going to be covered by the carrier.
Yeah, and that's the important part to understand is when you sign up for one of these programs, you are not at risk for that 20% that you would be at risk for if you didn't sign up for.
Correct. And then there's also dental, vision, hearing, transportation that are built into the Medicare Advantage plans. That's kind of, and there isn't sometimes on those supplements.
Yeah, so the extra benefits that are built into the Medicare Advantage plans and the carriers, that's how the carriers compete with each other.
Yep.
So talk a little about that before we go to break here.
Well, and typically, the out-of-pockets, obviously you're going to look at an out-of-pocket, but they kind of range $3,000, $4,000, $5,000, depending on. So they actually do compete with dental benefits, and they also compete with transportation or vision and hearing and over-the-counter products. So you can get like your Tylenol, floss, NyQuil, vitamins, and things. The carriers will give you a card to be able to utilize those over-the-counter products.
They give you a debit card.
Uh-huh.
And so I think the one that Blue Cross has is called Blue Bucks.
It's a flex card, and there's quite a bit on there to do whatever.
Yeah, so what's a classic example of how the particular on that Blue Cross one, how it works? On Blue Cross of Kansas City, for example.
On Blue Cross of Kansas City, depending on which plan you have, there can be one of the essential plans has like a $250 max out of pocket. I mean, a maximum OTC. On the other one, there's $2,500 on that one that can be used
for you to use.
For you to use dental, vision, hearing, transportation. If you want to use it all for dental, you can pivot it and use it all for dental. And if you're over the counter, you want to get, you'd rather pay for that and have all your dental. Dental's expensive.
Yeah, it does.
There's that $2,500.
So this is just an example. We'll get more in the weeds on this stuff as we go through the show, but this is just an example of why you want to talk to somebody like Carolee at RPS Benefits by Design, because she is an expert. And you can tell that by listening to her in how to navigate through this alphabet soup. And did you even know there's a Blue Cross plan that actually has $2,500 on a debit card? You probably didn't. You would if you talked to Carolee. You could do that by calling 877-385-2224, 877-385-2224, or their website, RPS Benefits by Design Inc., that's INC.com. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast, across the USA. Don't go anywhere. We've got more.
The Golden Rule. Treat others as you want to be treated. I'm Steve Keeker, and this is one of the founding principles of my firm, Senior Care Consulting. Since 2002, our value statement has included honor our mother and father, respect our elders, care for those in need, and treat your family as our own. We've been honored to help hundreds of families make one of the most difficult decisions they could ever make, serving them in their greatest time of need. If you're looking for someone who can provide you experienced and objective guidance when searching for a senior care community, reach out today and discover the services of Senior Care Consulting at 913-945-2800, 913-945-2800. Know your options and choose with care at seniorcareconsulting.com.
Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HI Radio Network. As I said, you're listening to this. Maybe you want to tell somebody about the Medicare show and what Carolie's saying and what Maria Ahlers is going to talk about here. You probably want to go up to the podcast platform. They're loaded on all the podcast platforms. There's 15 of them out there. We're on every one of them, from Amazon to Pandora, you name it, we're on it, okay? Rumble, all of them. And we're on YouTube. You can always get the episode off YouTube, which a lot of you do. So if you want to tell somebody about this show, or maybe you want to share it, maybe you're a caregiver and you've got a 90-year-old mother and you need to have them convinced that this is something they should do. Maybe they should sit down and talk to an expert about, is that plan you're on really the best plan for you to be on? That's Carolee, Steele, and the team over at RPS Benefits by Design. You want to reach out to them. I don't care where you are in the country. If you're in Phoenix, Arizona, if you're in New Mexico, if you're in Florida, it doesn't really matter. Here in Kansas or Missouri, 877-385-2224. They can help you wherever you are, 877-385-2224. The website, RPS Benefits by Design Inc.com. So we were off air there a minute ago, and you talked about that. Your parents have that Blue Cross plan?
They do. Yeah, the 2,500. During open enrollment, I went to Carolee. She's down the hallway from me, and said my parents needed to switch their carrier. She got their prescription. She looked it up, looked at their network, and came up with some options. It's zero premium for both of them, and they get $2,500 to spend.
They like that $2,500?
Mom definitely likes the $2,500. She goes to, she'll go to the retail stores and she'll buy her Band-Aid or her Tylenol or her Zyrtec, and she calls me and she'll say, Maria, it worked. I'm like, it does work. It's just a debit card, and you just swipe it, and it works. The other nice thing we've been using it for is transportation, because it covers transportation. So, my parents used to live in Wichita, so they don't really know the roads here, and they have doctor's appointment. We just get an Uber for them, takes them there, and then brings them back.
That's wonderful.
Yeah, it really is.
Yeah.
Because most of us are having to go pick up our parents, take them to the doctor's appointment, drive them back, and that's a big chunk of our day. And this way, it really does help.
Yeah, you don't have to do it. And if you go to the doctor, you can go to the appointment, leave the appointment, come back to the office. You're not driving them back and forth and dealing with all that.
Yeah.
So it makes a big difference.
And that particular plan, also, the in and out of network costs are the same as far as the primary thing, because they spend some time, in Texas,
They do.
with other family. And so that was really important to them as well, that the in and out of network costs were the same amount. It wasn't like an in-network zero, out-of-network, this is what it's going to cost you.
And let me tell you, we were in California for a family function, and at that age, they're talking about their ailments. That's what old people do. So they talk.
Look, did you see she said that? That's what old people do.
That's what old people do. I'm sorry, but they do. They share their ailments. My back hurts. My this hurt and that hurt. And my mom could not stop talking about her $2,500 she gets to spend. And they're like, well, how much is a premium? And she said, zero. And they said, well, how did you get that? And she goes, my daughter. And so That's all she talked about was the $2,500.
The point of telling that story was to kind of drill that home a little bit. You know, when you're out there looking at these plans or trying to figure out what you're going to do, you know, you're going to get signed up, you've got to get to Part B, et cetera, and you're looking at all this stuff. It is extremely confusing, okay, as I illustrated in that first segment of the show. And this is a classic example of having somebody that's an expert that understands how to walk through all this stuff and turn around and find something that really works for you. And that's really what's important about this, is it not, Carolee? So. Mm-hmm. Yeah.
And Carrie, the icing on the cake is it's so easy. You just call Carolee, give her your information, she does her magic, and you're enrolled.
So, question, Carolee, does it cost more for people to use you as a broker agent than if they try to do this themselves?
No, not at all.
No.
And no, it doesn't cost any. People will go, well, how much do I owe you for the appointment? I said, no, you don't owe us. You know, we get kind of a backside on the carrier, but no, this is what we do, is to be able to help people out.
Yeah, and so it's not totally altruistic. They get paid by the insurance carrier for bringing people to the plans and putting them on it. But again, you're showing them a variety of plans. You're showing them all the different plans that are out there. You just heard Maria just said you got their meds and looked up their meds. How important is that?
Very, very important. And they need to know, like, what tier, where does it fall on? Will they hit the coverage gap? You know, and everybody knows there's a donut hole or a coverage gap. So, you know, and when they'd be able to do that. And so it's very important for them, because meds tend to be the hurdle in, you know, quite a lot of people. Because
as we age, there's more medications involved oftentimes.
And it's just not a one-size-fits-all. I can't reiterate that enough, that it's not a one-size-fits-all for this particular person. My uncle has this and that, and it's like, but that may not be the best thing for you or your mother or your dad.
Or I heard this at the Senior Citizen Center, and this friend of mine said, yeah, that friend of yours is not an expert, okay? And if you listen to that, that's probably... The other thing, and we talked about this in the very opening of the show, please don't go to the government websites. Or look at that. How many pages is that handbook? I meant to bring that to the show, and I forgot to bring it today. The Medicare
It's about that thick.
Okay. And, you know, I've been doing this for 27 years, and I sit down and look at that book, and how is somebody going to make any sense out of this? Mm-hmm. Because
it's different, because even UHC has two different types of plans in, like, the state of Kansas. You know, they have two different. How can you tell that if it's just in a book? You can't tell the difference. And so they go, what makes this one different than this one? That's where we come in.
Yeah, and that's, again, whether it's the prescription drugs, Maria said you went and checked those for her parents, or, you know, or whatever the issue is, then you can tailor make the issue to fit what that person's, because you said size 44 overcoat doesn't fit everybody. Okay, and that's why, you know, you may find a United plan is a better plan for you than a Blue Cross plan or an Aetna plan, or maybe a Blue Cross plan is better than either one of those. It just depends on what your needs are and what you're looking for. Right. So you talked about that out of network, especially for Maria's parents going to Texas. Explain that a little bit. Was that on the Blue Card?
That is that's on there's a Simply Blue plan that Blue Cross of Kansas City offers that has the in and out of network costs are the same. So if it's zero for a primary, you know, then it's going to be out of network is also going to be zero. 35 for a specialist, out of network will also be 35. So that just, you know, for some people, that gives them confidence, you know, and comfort is to know that. Otherwise, it's like I go everywhere in the Kansas City area, you know, it's no big deal. I'm okay with that. So it just depends. So each plan fits for, you know, you have to just look at someone's situation and know which plan fits them best.
So in Maria's parents' case, they go to Texas quite a bit. Mm-hmm. And so being able to have coverage in Texas is important. If you're a snowbird and you're going to Arizona or Florida, then obviously you're going to want to make sure you have coverage in either one of those places. Mm-hmm. That's why it's important to use an expert. Okay, this is not something that I suggest you try to do yourself. We've got some examples of that. We'll talk about one of those examples when we talk about ACA plans in one of the later segments, and what a mistake it can be to try and do this on your own. And then what happens if you do it and there's a problem. That's why it's important to use somebody that is a certified Medicare expert, and that is Carolee, Steele, and the folks over at RPS Benefits by Design. The phone number, if you're looking for help, maybe you've got a parent on a plan you're not happy with, whatever the case may be, 877-385-2224, 877-385-2224. The website, rpsbenefitsbydesigninc.com. That's rpsbenefitsbydesigninc.com. So if you want to learn more about our podcast or more about what we do on YouTube, you can go to the website, americashealthcareadvocate.com. As I said, those podcasts are on 15 podcast channels now. So they're out there on almost every podcast. They're on TuneIn, they're on Amazon, they're on Pandora. The list is long, okay? So you can find us on the podcast platform. And then all the episodes are posted up on the YouTube platform. So you can also go up and look for America's Healthcare Advocate. It's up there. And then all the episodes are posted up there. So maybe in this particular case, you're looking for this for Medicare to share this information with somebody or get somebody to do something in terms of maybe changing a plan or looking at a different plan. That's the best way to do it. Go to the podcast platform or go to the YouTube platform. We'll be right back after the break. Now you're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. Stay right there. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. You can find out more about us by going to the website, americashealthcareadvocate.com. Also, the YouTube platform is America's Healthcare Advocate, and the podcast platforms, just put in America's Healthcare Advocate. It's up there on SoundCloud, Amazon, you name it, iTunes, Pandora, Rumble. We're on all 15 of them across the country. In studio with me today, Carolee, Steele, and Maria Ahlers from RPS Benefits by Design. They are in-house insurance experts. We're starting off the show today, these last two segments, talking about Medicare. We're going to continue to talk about that a little bit in this segment and just kind of educating you on this alphabet soup of Medicare. How do you navigate it? How do you do it? Why should you do it? And if you're turning 65 or you have a parent who is aging and maybe they're having problems, these are the folks that can help you anywhere in the country. 877-385-2224, 877-385-2224, or the website, rpsbenefitsbydesigninc.com. All right, so let's go back a little bit. There are some options out there for seasoned citizens and also under the SpireCare model for folks that are just on regular health insurance. But let's focus on seasoned citizens right now. So we've got CenterWell and we've got SpireCare. Both are primary care centers. Yeah, correct. So let's talk a little bit about those.
Well, starting off with SpireCare, a lot of people are on SpireCare in the Kansas City area on employer plans, and they have had a connection with the center. It's kind of like they take care of the whole person. And so when they then go to Medicare, then with SpireCare, they actually have that availability with Medicare too to continue with their SpireCare doctor. But it's basically a center where they kind of take care of the whole person. You have a care guide, behavioral health you can have, and so it's kind of an all-in-one encompassing. A lot of employer groups with Blue Cross have that. And
a lot of individuals are on, like the SpireCare program.
Yes.
I think their retention is something like 90%.
Yes.
So when people get on it, they want to stay on it. There are 9 locations around the city, easy for people to get to, and people really enjoyed the experience.
Right. And some of the centers have, like, you can get an x-ray there, or you can get some, just generic medication there, depending on the actual location in the city. But once people get in there, they really love it. And so even when they go to Medicare, on the Blue Cross, they have that availability to be able to use their primary care doctor at SpireCare.
So, Maria, the CenterWell program is just for seasoned citizens. It is not for under 65. It's just for seasoned citizens, and there are 5 of those in Kansas City, and they're part of the Humana. But any carrier, if you're on Aetna, United, Humana, Cigna, you can go to the CenterWell programs, right?
That's right. You can go there, make an appointment. They will send transportation for you to pick up the patient and take them to the center to see a physician. You can call a 800 line and get an appointment set up. You can call Carolee and she can help you get the appointment set up. But it's I call it the Spira Care for senior citizens.
Yeah, it's really what it is.
Yeah.
And it's really, so that's the CenterWell program that's offered by Humana, actually, but it's open to, if you're on a Medicare Advantage plan, okay, and you want to try one of these primary care centers, the CenterWell program is great. If you're on United, if you're on Aetna, if you're on Humana or Cigna, you have access to those programs. Here's the thing. This is interesting. The average time that a person spends with a primary care physician in this country is 7.5 minutes.
I was going to say 5.5. But
yeah, you're close.
Close.
You know, we had Dr. V on here from CenterWell a couple of weeks ago, and he talked about, valedictory. He talked about how they do what they do. Mm-hmm. And then we had Dr. Castor on here from Spira Care. People are walking in there and sitting down, spending 45 minutes to an hour.
Correct.
Mm-hmm.
When's the last time you went to a primary care and had 45 minutes to an hour?
And that's what's so attractive about those is that situation of CenterWell and Spire Care is that they spend the time, they kind of look at the whole person, and then like with CenterWell, they hone in on the senior population, which is really important a lot to, some people, they really like that particular element of it.
Yeah, and by the way, the CenterWell clinics are around the country. You could be in Florida and go to CenterWell. You can be in Arizona to go to CenterWell. They have clinics all around the country, and you can go to their website, centerwell.com, and all that information is up there. So the CenterWell clinics are available, throughout the metro here, and in different parts of the country, they're available as well. So it's just a different model, and I think it's great, not just for senior citizens. The Spira Care is available for a lot of the group plans, Maria.
They are. A lot of our employers enjoy them because it is a one-stop shop. I mean, you can get like Carolee said, your prescription, your labs. They have a care team for you. They'll help you with your EOB, your explanation of benefits. If you go there and they discover some major medical issues, they will refer you out, and they will walk along with you on that path of your care plan.
Yeah, and that the other thing is, especially if you're an employer, your employees are going to be happy. There's no copay. Either on CenterWell, if you're a seasoned citizen, okay, or Spira Care, there's no copay. So the barrier to primary care is gone. There's it doesn't cost you anything to go see a primary care physician.
Correct.
And they also have behavioral health available at both CenterWell and Spira Care.
Right,
so
yes.
if you're dealing with behavioral health issues, it's also available. Yeah, I think it's just important that we get that kind of information out and people know about it.
They take care of the whole person, which is good, and they really like that.
Yeah, it is. So, we're going to switch topics here just for a minute. We're going to talk about special needs programs. Let's start about what are special needs, and they're available throughout the country, the different ones in every state.
Correct.
Okay, because the way they're set up. But let's just talk about special needs, and let's use Missouri as an example where there are multiple of these programs, and talk about, I think United Healthcare's got the plans in Missouri. Is that correct?
Yes, and yes, and so special needs, dual eligible special needs plan. Medicare is federally driven, and that people are eligible for Medicare. Some people are eligible for Medicaid as well, and that's state driven. So if you have both, then you have Medicare and Medicaid, you're considered dual eligible. And there is a DSNP plan, which is dual special needs plan, that is available with, so many rich benefits. The dental can be somewhere between $3,000 and $4,000, and then also vision, hearing, transportation. They're more rich than your average just Medicare Advantage plan.
And the out-of-pockets on them?
Well, if you're Medicare and Medicaid, it's zero and
That's
zero
right.
and
That's
zero.
important to understand.
Yes.
Okay, so talk about who qualifies for those. You got different categories. You've got chronic illness, so that would be somebody with type 1 diabetes.
Type 1 diabetes, any kind of heart, dementia, things like that. That's chronic special needs, and those type of plans hone in onto the particular needs of the like the terminally ill or some very chronic conditions. Dual eligible Medicaid is income driven, and so that they particularly they have very rich benefits for people. They think, well, I have Medicare, Medicaid. I don't need anything else. But
it's back to this discussion. You don't know what you don't know.
You don't know what you don't know.
Right. And here, if you get this plan, you may have all of that, but you can step up to another level of care, greater opportunity, and not pay for it.
Correct. And case managers, they can the case manager for Medicaid and Medicare, they can kind of work together. People who do not look into the D-SNP plans, they are leaving a lot of benefits on the table.
And so let's talk a little bit about that. Let's say you've got a 94-year-old mother and she's in a facility and that she could qualify for this program. So talk a little bit about that.
There's an institutional special needs plan, and then, it depends on the criteria. And like I said before, with the chronic, it's geared specifically to the needs of those particular seniors.
So so if they're in a nursing home or in a facility of some kind, then maybe it's a memory facility, they would qualify for the program.
Yeah, to kind of the criteria, they'd have to go through the criteria. So there's institutional, there's chronic, and then there's the dual eligible, the ones that have Medicaid. So those are the three special needs plans, and they're very rich in benefits. And
there's a process you have to go through. And that's what you do. So talk a little about that.
Well, and we just kind of look at their eligibility. What kind of level of Medicaid do you have? What type? Do you have Medicare and Medicaid? Would you qualify for that? So we go through all of that and just look to see what is available for those particular needs for that individual.
And you're able to do that, get it through the paperwork.
Go through the process, go through the paperwork. We handle everything with the carrier, and then, then they're enrolled.
So if that's your parent out there or your grandparent aging and they have some of these issues, maybe they are type 1 diabetic and they're on a plan, but they don't have this particular plan, you really do need to, again, you don't know what you don't know, and you need to take the time to pick up the phone and give these folks a call. Call Carolee or one of the folks over at RPS Benefits by Design. They'll walk you through the whole process. You don't have to do any of it, and they'll help you get it done.
And let me piggyback on that just for a minute. Dual eligible people don't have to adhere to the annual election period. They can enroll in each quarter. So
that's important.
Very important.
I didn't even know that. So you're already on a plan. Maybe it's a parent that's already on the plan, whatever the case may be, or you're on the plan, and you just listen to this and, hey, I could be eligible. Maybe my husband's eligible or my wife, whatever the case may be. You don't have to wait for open enrollment. So again, call Carolee at 877-385-2224. That's 877-385-2224, or online at rpsbenefitsbydesigninc.com. We'll be right back with more after the break. Stay right there. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. Our producer on the microphones, Mr. Darren Wilhite. Our producer behind the camera, Mr. Dave Thiessen, putting it all together to get it up on those podcasts and YouTube sites. If you want to learn more about us, the website, americashealthcareadvocate.com. That is the website. Send me an email. If you've got questions, I am happy to answer it. If I can help you with something, I'm happy to do that as well. Once again, the website, americashealthcareadvocate.com. And if you want to speak to one of the experts at RPS Benefits by Design, like the lovely Carolee Steele, 877-385-2224. She's there to help you if you're looking for Medicare. If you're looking for employer-sponsored, we're going to get to that in the next segment. So if you're looking for employer-sponsored healthcare, maybe you got one of those big premium increases and you're like, I don't like this. Well, call Maria, have a conversation with her, 877-385-2224, or the website, rpsbenefitsbydesigninc.com. Let's go back through that special enrollment because we did that right at the end of the segment, and I want to make sure people understand. First of all, the three categories for special enrollment, go through that again. Okay, chronic disease.
Oh, chronic disease.
Institutionalized.
And dual, which means Medicare, Medicaid.
Yeah.
Yes.
So any one of those three can qualify you for one of these programs. They are extremely benefits rich. They have no out-of-pocket.
Right.
Okay, and that's a big deal.
Yes.
Okay.
For the Medicaid eligible. Mhm.
Correct. And they offer a whole series of benefits that the other plans don't offer.
Yes, absolutely. And they offer much more. Other plans do offer dental, transportation, hearing, but not in the amounts that these do. Like there's 3,000 to 4,000 in dental sometimes with some of the D-SNPs. One of my sweet little men that I visited and got him a dual needs, he goes, "You mean I can get like dentures I can smile on my next birthday?" I'm like, "Yes, you can." So, and that's a lot.
But people don't know that. That's
their-
why we do these shows, is so you can understand what's out there, because it's complicated. You know, I keep saying that, but it is. And if you want to talk to somebody that really understands how to navigate this and get it done, that's what these folks do. So, there's an open enrollment period for Medicare. We're not talking about that. We're talking about special needs. It's different. How does that work?
The special needs, they can enroll once per quarter. So, January to March 31 and so forth. So they can enroll, like right now, annual election period is over for most Medicare.
Right.
They can enroll right now for the next
special needs program.
Absolutely. They can enroll
and
once a quarter.
in the next quarter, they could do the same thing.
If for something didn't work out, they can do the same.
Correct. So that's important, because if you don't know that and you think, well, I'm locked in until next year because I've got mom or dad on a program, but maybe they're institutionalized or you're not happy with the way things are going, there's some opportunities here that can make a big difference. Or just like Carolee said, the gentleman she just did this for said, "Gee, I'm going to get a $3,000 dental benefit. I can go get my dentures done." Yeah. I mean, these programs are designed to help people that don't have the means. That's what this is for. All right. And it is a great benefit, but you have to understand how to get it, and you have to understand how to navigate it. So that's really important.
And the carriers now, the new benefits are food allowances and to be able to have money for utilities. So food allowances is a big thing for some of our seniors. You want to make sure to talk to one of us, like if the food allowance, then what's the out-of-pocket? What am I giving up for it? It may still be nothing, but those food allowances and the money to be able to pay for utilities is so important for so many seniors.
Wow. So there are food allowances now in these special needs programs.
Yes.
Okay. And the same thing with utility allowances. So if somebody's living on just Social Security and they can't make ends meet, this could make a big difference.
And right, for dual eligible who are Medicare and Medicaid, those are available. So that's what you want to just look over. If that's really key important to them, then that's what we want to address.
Those are called Medicare Special Needs Programs. Once again, you can reach out to Carolee, 877-385-2224, and she'll be happy to help you. Let's kind of go through, back through this a minute. The regular Medicare Advantage programs are offering some of the things they're offering as additional benefits for people. These are zero premium plans. Okay, they don't cost any more for you to sign up through RPS Benefits by Design if you try to do it yourself. Of course, the difference is you may sign up yourself and find out that formulary doesn't cover your medications. That won't happen if you're talking to the folks at RPS BBDI. So let's kind of go through the additional benefits that we talked. We touched on that Blue Cross and Blue Shield card, that debit card that Maria's mother really likes. Let's talk about some of why do they do that? And what are some of the benefits they offer?
For a D-SNP, they've got dental, vision, hearing, transportation, over the counter. You've got food allowances, utilities. I mean, sometimes that keeps people in, maintenance mode, because there's a lot of those seniors that, are a little food deprived. And, one of the guys we were talking to, and he goes, I might actually be able to go buy a roast instead of my canned thing that I always get, So he was so excited to be able to have a food allowance, to be able to kind of, up the quality of his food.
Now, that's not on the regular Medicare Advantage plans. Let's talk about those benefits.
Yeah, those on a regular Medicare Advantage plan, they have dental, vision, hearing, and transportation. It is, more minimal than, of course, the D-SNPs, but they still have that available. And each plan differs, like with, each plan differs. Some have a large dental benefit. Some have them compartmentalized where they have this much dental, this much in transportation, and this much. Some of them have, like Maria's mom, dad, have the whole $2,500 to spend how they need to.
Yeah, and that's really, so that whole $2,500 can be going to get those over-the-counter meds, whatever the case may be, or that whole $2,500 could be, I need a new set of dentures, and this is going to pay for 80% of it, or whatever the case.
And some of the regular Medicare Advantage plans have the opportunity to buy a dental buy-up. So they'd pay an extra maybe $25 a month. They'd have a dental buy-up, so they'd have $2,000 in dental and still have their $2,500 to move toward that. So potentially it could be like a $4,500 benefit.
All the shows are posted on YouTube platform, America's Healthcare Advocate. You can also go to the website, rpsbenefitsbydesigninc.com.
And I do have one thing to say about
Please.
that. Just we are licensed in many, many states, and we represent all the carriers. So I want to make sure that people do know that. Even though we've been talking about Blue and UHC and CenterWell, I just want to make sure they knew that.
Yeah, we're carrier agnostic, okay? It's what works best for you. Okay, let's switch gears,
Yep.
Maria. So let's talk about, the people that are the most challenged on the employer side, on the group side, are small businesses. Without a doubt, they're the ones that are suffering under the ACA model. Premiums keep going up significantly. That pool of people in those plans continues to shrink because there are no subsidies for employers. They're paying for it out of their pocket. So let's talk about that and how you're able to help employers, small group employers like 1 to 50, right?
Yep, that's what we consider small employers.
So talk about that.
Yeah, I'd love to. Small employers are companies with fewer than 50 employees. They do have a challenge because of of the number of employees they have. Not every carrier will provide coverage if you don't have a minimum number of employees. However, we have experts to help you with that. Whether it's one employee, meaning you're a LLC of one person, you're an accountant, you're a lawyer.
You're an Uber driver.
Right, you're an Uber driver. We have an exclusive partnership with a carrier that we can provide you with a PPO plan. So a PPO plan is better known as the plans with copays. You go to the doctor, you pay a certain amount. You go to a specialist, you pay a certain amount. You go get your prescription filled, you pay a certain amount for tier 1, 2, 3, and 4. So we have those plans available for really anyone that needs group employee benefits.
And they're available, again, around the country. It doesn't matter where they're at. They can be in Arizona. They can be in Mexico. They can be here. They can be in Missouri, Kansas, whatever the case may be, and you're able to help them with whatever it is they need. That's
right. We can help them with whatever they need. If they have, as Carrie, you mentioned earlier, renewal rates go really high. Every year I hear from our clients, premiums keep going up, and they do. They keep going up, and we have to find ways to keep the costs down because benefits are the largest piece of overhead for a company.
Yeah, they are. They're next to payroll.
That's right.
That's number 2.
That's right.
Okay.
Yep.
And the other problem is, if if employers just walk away from this and they're not going to offer coverage, then they have some challenges with that, don't they? They do.
There are some compliance challenges. Certain size employers are required to offer benefits to their employees, and if they don't, they can get fined thousands of dollars per day per employee. So we really want to avoid that. But also, the biggest piece is recruiting and retention. The number one reason that people accept roles are because of benefits. I mean, you hear of husband, wife, a 2-income household where the husband or the wife have their own business, but the spouse continues to work for an employer for the benefits. So benefits is a big part for recruiting and retention.
Yeah, and recruiting and retention and the level of employee satisfaction.
That's right.
If you're offering a lousy plan,
that's right,
or you're shifting cost over to the employee, unfortunately, a lot of employers do this. That may look good in the short term, but you better start looking at your turnover rate.
That's right. You do. You need to look at your turnover rate, not only because of the morale for the organization, but also when you get new employees, that affects your plans because it depends on your claims. It depends on the group's medical history. It depends on the risk aversion for a certain group. So that's why, again, not just with Medicare, but employer group benefits, you should reach out to an expert, let them know what your challenges are, what your pain points are, if the benefits are working well for your employees. I always say, there's no reason to offer a benefit if no one's going to take advantage of it. And so it's really important to make sure that your benefits are meeting your employees' needs. We always strongly encourage a benefits survey done every year just to do a climate check with your employees.
So let's talk about that a minute. Mm-hmm. So I just renewed my policy with my company. I'm an employer. I just renewed it last year. I went through the painful process. I'm not really happy. We got a 27% increase. My employees are complaining. They're not happy. We got a narrow network because we had to lower costs, so we accepted a narrow network policy. Now I've got employees who can't see the doctor they used to go to. Their wives are unhappy. Their husbands are unhappy. Whatever the case may be, they can't see the pediatrician they need. Wouldn't that be a great time to fill out that survey and let you guys go look at everything in the marketplace, some of which isn't offered by what we call the BUCA carriers, Blue Cross, United, Cigna, etc. There are plans that are outside of the box,
yes,
okay, that are great plans around the country that are different than that. That can solve a lot of those problems.
Yeah, there really are plans that will meet every employer's needs based on what they know. Employees are very vocal about benefits. It is the number one most important thing to them. Not only does it impact their health, their families, but also their pocketbook, Carrie.
Oh, it's huge.
Yeah, I've seen people, go bankrupt because they didn't have the right plan. And that's what we also do. Not only do we help the decision makers of organizations figure out what's the best plan for their team, but also we can sit down with the employees and talk about what's best for their family. Because many times, even with small employers under 50, we can still offer 2 or 3 plans. One size doesn't fit all, and we want to have those choices out there for them.
Yeah, and that gives them that opportunity to have those choices. So reaching out to you to do that survey, then you have the information you need to go back and say, well, we've got some recommendations here.
We do.
Okay.
Yeah, we do. And again, like you mentioned, we have options besides just the major BUCAs. They're wonderful. They're great.
They don't fit everybody.
They don't fit everybody. But we work with every carrier, and we know the plans for every carrier. And we've had clients with every type of situation where we know where the right carrier might be. And we present you with the options and talk you through it and talk about strategy. Healthcare is not a short-term fix. It is a long-term strategic goal.
So, I used to do a commercial for Benefits by Design, which was my company then before it merged with RPS. And I said, if your broker or agent tells you to call the 1-800 I don't give a damn number, and that was referring to the customer service number for a lot of different carriers who really don't have good customer service. Mm-hmm. Talk about customer service. One of the big things about RPS Benefits by Design, and by the way, my daughter and her husband, their company is with RPS Benefits by Design. They're in Washington State, okay? So believe me, I know how the customer service works. That to me is one of the key differences between the way RPS BBDI works and other agencies and brokers. It's just call the 800 number for the carrier.
Yeah, we give you, the term is widely overused, but it's the best way to describe it. It's that white glove service, that concierge service. We have actually an agent on our staff that he takes appointments. You can call him, whether it's an employer, an individual, Medicare, and he will do the enrollment for you. He will walk you through the plans, talk you through what your needs are, and get you enrolled, and all you're waiting for is your card.
But if you have a problem, you're on a plan and a claim doesn't get paid, they can call you.
Yes, they can call us, and we'll have one of our account managers or one of our client services person give the carrier call. As a matter of fact, just the other day, we had an employee email me saying that her husband needed to have eye surgery. Called the eye doctor's office, and they didn't have him in the system. We got the doctor's office phone number. We got the husband's phone number. We called the doctor's office, gave him the information. We also told her that we need to also consider her medical insurance to cover some of it. And she was so grateful because she didn't even think about the medical piece of it. But that's the expertise we bring.
And that's what customer service is all about, and that's something they do at RPS Benefits by Design. If you want help, 877-385-2220 for your employer. Maria is happy to help you and show you your options out there. Thank you both for doing this today.
Thank you,
I think we had a lot of information out there today for a lot of folks. And now I leave you with this thought from Dr. Albert Einstein. The one who follows the crowd to usually get no further than the crowd. The one who walks alone is likely to find himself in places no one has ever been. Remember, friends, it's a funny thing about life. If you refuse to accept anything but the very best, you most often get it. Thank you for listening to America's Healthcare Advocate, broadcasting coast to coast across the USA. Goodbye, America.